So hello everyone, today we're going to talk about a drug which is an antifungal called fluconazole. Okay, so this is about the capsule of fluconazole that contains 150 milligrams of fluconazole in a capsule. So let's talk about the dosage for this medication. So for adults, okay, for prevention of relapse of oropharyngeal candidiasis in patients with AIDS, after the patient receives a full course of primary therapy, so we may administer a 150 milligram once weekly dose of fluconazole. As for vaginal candidiasis, we should give 150 milligrams of fluconazole as a single oral dose. To reduce the incidence of recurrent vaginal candidiasis, we may give 150 milligram once a month dose. And the duration of therapy should be individualized, okay? Shouldn't be there isn't a blanket rule for all kinds of diseases, but we have to individualize the therapy according to the person. But the usual range is about 4 to 12 months of treatment. And some patients, of course, may require more frequent dosing. For Candida balanitis, fluconazole 150 milligrams should be administered as a single oral dose too, just like vaginal candidiasis. For prevention of candidiasis, the recommended dose is 50 to 400 milligrams once a day, based on the patient's risk of fungal infection. For skin or dermal infections, including Tinea pedis, Corporis cruris, and Candida infections, the recommended dosage is 150 milligrams once per week. And the duration of treatment is normally 2 to 4 weeks. But Tinea pedis may require treatment for up to 6 weeks. For Tinea versicolor, the recommended dose is 300 milligrams once a week for 2 weeks. And a third weekly dose of 300 milligrams may be needed in some patients, whereas in some patients a single dose of 300 to 400 milligrams may be sufficient. That is for the normal patients. So let's talk about the use of fluconazole in individuals or in patients with renal impairment. So patients with renal impairment will have fluconazole predominantly excreted in the urine in the unchanged form. For the single dose therapy, there is no adjustments of the dose needed. And for the multiple dose therapy, normal doses should be given on days 1 and 2 of treatment. And after that, the dosage intervals of the daily dose should be modified according to the creatinine clearance. So if the creatinine clearance is more than 50 mL per minute, then we may give the normal dosage regimen. If it's 11 to 50, then we may give the 50% of the normal daily dose. And for patients who are on regular dialysis, so we give 1 dose after every dialysis session. So you may need to further adjust depending on the clinical condition. As for use in children, there are limited data available on the use of fluconazole for genital candidiasis in children below 16 years old. So use at present is not recommended unless antifungal treatment is imperative and no suitable alternative agents exist. So actually, this is actually for a different drug. So when you talk about adults and children, we're actually referring to those above 16 and below 16. So about teenagers and below, okay, and not so much of children 3 to 12 years old. So administration of the drug, I think that's straightforward, as mentioned in the previous slide. Indications. What are the indications and what are the reasons for us to prescribe a patient with fluconazole capsule on 150 milligrams? So firstly, mucosal candidiasis, and this will include oropharyngeal, esophageal, non-invasive bronchopulmonary infections, candiduria, mucocutaneous and chronic oral atrophic candidiasis. And we can treat the normal host and the patients with compromised immune function, and also can be used to prevent the relapse of oropharyngeal candidiasis in patients with AIDS. So that's the first one, under mucosal candidiasis. Secondly, genital candidiasis. So it can be used to treat vaginal candidiasis, whether acute or recurrent, and also can be used as prophylaxis to reduce the incidence of recurrent vaginal candidiasis with 3 or more episodes a year. And then also can be used to treat candidal balanitis and for prevention of relapse of oropharyngeal candidiasis in patients with AIDS. Okay, besides that, number 3, we can use fluconazole for prevention of fungal infections in patients with malignancy who are more predisposed to such infections as a result of cytotoxic chemotherapy or radiotherapy. So that's the third one. And the fourth indication is dermatomycosis. Okay, dermatomycosis. So dermatomycosis including tinea pedis, tinea corporis, tinea cruris, tinea versicolor, and dermal candida infections. So contraindications. Of course, you shouldn't use fluconazole in patients with known sensitivity to the drug or sensitivity to any of the inert ingredients or to related azole compounds. And we shouldn't co-administer terfenadine in patients receiving fluconazole at multiple doses of 400 milligrams per day or higher than that. So anything 400 milligrams a day or higher, then you shouldn't administer terfenadine at the same time. And also you cannot administer cisasprid in patients receiving fluconazole. It's usually not advised in patients taking halofantrine. Precautions. It has been associated with rare cases of serious hepatic toxicity, including deaths, fatalities, primarily in patients with serious underlying medical conditions. The fluconazole hepatotoxicity is usually reversible when you discontinue the therapy, and patients who develop abnormal liver function tests during therapy with fluconazole should be monitored for the development of more serious hepatic injury. And this drug should be discontinued if clinical signs or symptoms consistent with liver disease develop that may be blamable or attributable to fluconazole. And patients on fluconazole have rarely developed exfoliative cutaneous reactions such as Stevens-Johnson syndrome, toxic epidermal necrolysis, and patients with AIDS are more prone to the development of severe cutaneous reactions to therapy. Patients with AIDS, they are more prone to develop severe cutaneous reactions to fluconazole and also many other drugs. And if a rash, which is considered attributable to fluconazole, appears in a patient treated for a superficial infection, then further therapy with this agent should be discontinued. And patients with invasive or systemic fungal infections who develop rashes should be monitored closely, and fluconazole discontinued if there is development of bullous lesions and erythema multiforme. If you want to administer tafenidine and the fluconazole are at low doses below 400 milligrams a day, then we should carefully monitor this. In rare cases, as with other azoles, there have been reports of anaphylaxis, and cases of torsade de pois and QT prolongation have been reported rarely, and caution is advised when giving fluconazole to patients with pro-arrhythmic conditions. So patients who are prone to develop arrhythmia, then we should consider not giving this to patients. So fluconazole may cause torsade de pois. Okay, we'll see you again in the continuation of fluconazole in the next series. Thank you.